don't say no to sugar. It's completely not doable. It has nothing to do with appearance. This is one of the things that I teach my patients all the time.
Okay. So, hello everyone, my name's Dev.
And my name's Sahil, and welcome to Diabetes Roundtable. We're part of a student-led nonprofit organization, Relief Care and Foundation. We aim to provide support to people with diabetes worldwide through widespread access on social media and other platforms, such as the podcast like this one.
So, today we're very lucky to be joined by Dr. Shah, who is an acclaimed pediatrician and clinical director at Barry Community Health and has worked with many young patients over the years. So, Dr. Shah, if you could please introduce yourself in a little bit more detail.
Sounds good. Thank you for having me, guys. My name is Dr. Swetang Shah. I'm a pediatrician by training, and I function as a clinical director at one of the large community health center. And I also serve Santa Clara as an area director for American Academy of Pediatrics. Thanks for having me.
Yeah, of course. Thank you for joining. All right, then I think we'll get started. So I guess we'll start with something that's more helpful towards parents. So I guess the first question would be, what are some early signs of diabetes in children's that parents should look out for? And then when should they start seeking medical attention?
Yeah, that's a very good question. Thanks for highlighting that topic because, I tell parents most of the time that trust the pattern. If a child is showing any sudden drinking of a lot of water, they are urinating a lot, suddenly they are bedwetting their beds when they were completely having good control in the past, and they are feeling unusually tired. Those are the common symptoms that we usually see, but we shouldn't stop there because there are, as you know, there are two types of diabetes, and some diabetes even show with very acute symptoms. Like, what you like suggestions or symptoms would be vomiting, belly pain, deep and rapid breathing, confusion, dehydration, and extreme sleepiness. So these are some of the common symptoms that you might see, especially this acute symptoms that you're seeing. That can be because of that can be isolated or in combination, and that's very serious. That's type 1 diabetes.
Got it, got it. So like just to clarify, some of the symptoms like dehydration. So so diabetes sort of causes a need for more water in the body.
So diabetes is, in short, is basically lack of insulin or insulin resistance. So type 1 is that pancreas can secrete insulin in your gut, right, and in the bloodstream, and the sugar is exceedingly high, or if insulin is present, it's not able to do its function because of the resistance, and that's type 2, to be just very simplify that.
Mhm.
Okay. And also, I was wondering, so like some of the symptoms that you mentioned, like they can also be associated with just like someone who's like going through like a normal like sick day or something. Is there like a few extra signs that like parents should be aware of before getting their children tested for like diabetes?
Uh, so it's very quiet in usual. Like type 1 presents sometimes suddenly, sometimes with polyuria, polydipsia, which is increased thirst, increased urination. And, like if you see the pattern happening frequently, you should rather see a doctor and get checked out. No time is early. We used to think back in the days that type 2 diabetes usually happens only adults. More and more data shows it's also happening in kids.
Yeah, I guess touching on to that, we want to ask another question.
Mhm.
So there's a rise in, like, as you just said, type 2 diabetes with children, whether that's through processed foods or whatnot. So what could families realistically do in order to lower their child's risk of diabetes?
So the question is how to reduce the risk of having diabetes, right?
Yeah, of type 2.
For type 2 specifically. Okay.
Yeah.
I think, for families, prevention has to sound very realistic according to their situation. It doesn't have to be perfect. So, very simple lifestyle changes like fewer sugary drinks, and don't say no to sugar. It's completely not doable, right? As kids or teenagers, it's very difficult to do that. Um, Drink more water. Okay, more meals to be eaten regularly with the family members, instead of eating alone in front of the tablets or television, right? And then I would also suggest sleeping better, because sleeping is so underrated, and a lot of people miss out on that, and it catches up on you on a later stage. So my suggestion is 9 to 12 hours of sleep in a child who is 6 to 11, and about 8 to 10 hours of sleep in child who is or a teenager.
Okay, that's really interesting. But could you elaborate on how eating with family is like good for preventing type 2 diabetes, whereas like eating alone?
So, very, very good question. Thanks for asking that. One of the reasons is that when you sit with family, you are having a social environment. No, more and more research and evidence is showing that having a family around, a caregiver, or a social environment for you reduces genetically the amount of telomeres in a genetic composition, and it kind of reduces your stress. Number one. Second way is that you are not watching screens at the same time, and you don't know how much you are eating. Sometimes you eat rapid, sometimes you eat very, very slow. And screen related eating, usually we feel like eating junk food, like you watch a movie and you want to have a bunch of popcorn and soda, right? So it's very common, right? And nothing to be blamed. I think no one is to be blamed here. It's just that the whole house system is going, and eating with family and parents as many meals as possible. I say to my patients at least one meal in the evening, because they're doing a lot of things, they're going to school. But if you can have two meals, breakfast and dinner together, would be much better.
Hmm. Yeah, I think that makes a lot of sense, right? So, like, especially for teenagers and sort of older kids, they sometimes face a lot of stress, whether that's relationships, school, any activities they have. What effect does stress sort of play in diabetes? Is there anything that they can do to reduce it? Just anything that sort of helps in that sense.
There is a lot of data with kind of toxic stress in the environment, needs to be mitigated. Research says that the more negative adverse childhood experiences a child or a teenager has with them in their environment, it's highly correlated in their adult life to have chronic health conditions. Diabetes, not only diabetes, but also high blood pressure, early cardiac events like coronary disease or heart attack, we call in simple terms. So, and high amount of depression and suicidal activity. So, there's definitely a lot um, to work upon in mitigating these stresses in their environment. I'm talking about hardcore adverse childhood experiences.
Yeah. So just stress is like still a major part of diabetes. It can still affect a lot of not only that, but also just to simplify, it also helps mitigate a lot of like cardiac issues specifically.
Yes, diabetes, high blood pressure, cholesterol issues are directly related to cardiac events. So, coronary events, we call, and those coronary events will drop down if you mitigate those toxic stress by simply introducing positive experiences in their life, having a simple caregiver.
Okay, that's what. So also, I feel like this kind of relates to like one of our other questions that we have. So like, when you see a child with diabetes, what strategies or approaches do you most often recommend that really make a difference in their health and well-being over time?
No magic, nothing dramatic, consistent routines. Sounds boring, but consistent routines with lifestyle, which we talked about, just touched upon before. Education to the family. What you guys are doing is amazing, because you are educating people through this channel, through this podcast. So, and we take every opportunity. If a family comes in, we educate them what diabetes is, and then follow up. Make sure the child who has diabetes, they follow up with their provider or a physician or a doctor who they are seeing. It's very, very important. And then also I would suggest understanding how food and activity, both diet, healthy eating, I would say, and exercise affect your glucose. To understand that, I would say those are the differences that you can make in a family's life, you know.
Yeah, that definitely makes sense. And then touching on how you constantly or consistently meet with patients and all that, you meet a lot of toddlers, teenagers, children of all ages. So just from your experience, how have you seen that, different age groups have adapted to diabetes? How differently has it affected them?
Yes. So if someone has a diabetes as a toddler versus a teenager is a complete different ballgame, right? A toddler is the one who is highly relied upon their caregiver. So first, they should have a adult in their life who is helping them as a toddler. A lot of toddlers are in foster homes, so they are affected very badly. But if they, most of them have a caregiver. So a toddler depends on entirely on caregivers. So the burden falls heavily on, parents, caregivers. The issues often that if you see is unpredictability in feeding patterns, uh, fear of lows, sleep disruptions, daycare and caregiver stress in toddlers. But in teenagers, on the other hand, they need autonomy, right? They are worried about independence. They want their independence. They are worried about body image. They have social identity issues, right? So they need more privacy, and they need that this diabetes is like a normal part of their life. So the approach for me, yes, age matters. Age changes adaptation, how you deal with diabetes. With toddlers, I support the caregivers intensely. That is my plan. And with the teenagers, I try to build autonomy with them. Try to build the rapport instead of judging them, and give them that independence, so that they are more adherent to the treatments, compliant to what we suggest.
So like just to sort of brief up, with younger children you want to sort of make like a base with adults, with parents, with diet, sleep, all of that, and then same thing with teenagers, but I'm guessing more on a in an individual stage almost. But the other aspect with older children is like their social life and how they connect with others with diabetes.
Yeah, and it also, it should matter which type of diabetes we're talking about. If in teenager it is type 1, there needs a lots of work as an caregiver who really understands the the adolescent, the teenager, where they're coming from. There can be a lot of mental health concerns, and they need behavioral health support too during this time.
Yeah, so just to touch on, how would type 1 differ from type 2?
Right. Type 1 does not produce insulin at all. So it's kind of, you can say, 0 to 10% insulin at the most. And so they are affected very severely, and they can go into hypoglycemic or hyperglycemic state very fast. Right. And that is what the previous first question, when you guys asked about that emergency crisis, when they present with vomiting and abdominal pain and drowsiness and other things, it is most likely diabetic ketoacidosis, which means their body is full of acid in the blood, and their pH drops, and that causes multi organ failure eventually. So, to prevent that, we need to intervene early. So, type 1 is different from type 2 um, in that difference in that zone, and they are more reliant on insulin and insulin pumps for type 1. Type 2 can be treated by lifestyle, if not, then oral medications, sometimes injections weekly that we talk about nowadays, GLP-1s with new technology. So that's how
Mhm.
it's different.
And then just quickly touching on, the injections and insulin stuff, where can families access this? Where can they sort of get a hold of this if they need it?
Are you talking about insulin injections? Are you talking about the new medication GLP-1 like semaglutide and other things?
I guess both, but more on the insulin.
Insulin, they can access, they can see their doctor. They will write a prescription for them. They will do calorie counting and prescriptions for them, and they can pick it up from their pharmacies. And we also have lots of support around how to use insulin, when to use it, and how much food calorie counting that you need to do to take the right dose of insulin. um, and they have a pump that they can attach themselves to, and it just you just select the number, and it can just deliver the right dose based on the pumps.
Got it. Got
Got
it.
it. So also, I was wondering, like, since our organization works with a lot of like underprivileged like patients, we we know that like a lot of people like are usually unable to afford like the insulin and diabetes medications. How do you think like people in these situations should like navigate like this affording these medications to help their like family?
So, this is very important question because there are a lot of disparities, not only racial or ethnic, but social disparities, and there's lack of access for this kind of patients. And we are federally qualified health center. We receive grants and support from federal and state government. So. Centers like us, they can look up FQHCs, community health centers. They can find doctors. They can find everything that's related to primary care, and then we also help them to enroll to member care services, which is enrolling them for insurance for what they are eligible for. So California state is amazing in that terms. They have lots of support for um, patients who cannot afford this. And also there are pharmaceutical companies that will have high amount of coupons. We work with them together where they can receive these services. Most of them, one or the other way, will receive their services, especially with type 1. Kids will never go without their services. There are specialists, endocrinologists, amazing organizations in Bay Area, Stanford and Valley Medical Center, UCSF. They really help these patients. So type 1 is rare, but it can happen.
Hmm. Okay. Okay. Um, I guess we'll go through a quick section, myth or fact. This is something that we like to do.
Sure.
We'll just ask the question. Just let us know, is it true, is it false, and then feel free to explain however you feel. So you.
Okay, so myth or fact: children with diabetes are unable to participate in strenuous physical activity like their non-diabetic peers.
It's a myth.
Okay. Okay.
Okay.
Is there any explanation that?
Yeah, yeah. I mean, they can function as well as people who have no diabetes. It's completely doable. Type 2, even more so. We encourage doing that. For type 1, with the right treatment, right management, with right education, definitely take care of that.
So I guess touching on that, the physical activity part of it, especially you said how it's important for type two. How how much of an effect does it have on people with diabetes? You know, is it very helpful? What sort of ways does it support them?
Are you asking about physical activity
Yeah.
specifically?
Yeah.
Yes, it has tremendous effect on patients with diabetes. It can reverse a lot of people's type 2 diabetes, and that's what our goal is. I recently actually published an article on pre-diabetes. Not an article; it was a poster presentation in American Heart Association that happened just on 17 March. We talked about the prevalence of pre-diabetes. We just talked about how much it increases. Diabetes is not adult only anymore. It is also in teenagers and younger age groups. We find especially pre-diabetes is increasing a lot. And pre-diabetes is specified based on their hemoglobin A1C that we test in them. That's how we diagnose them. Anywhere from 5.7 to 6.4 is pre-diabetes. 6.5 and above is diabetes. So to answer your question, we start intervening with lifestyle changes, physical activity, healthy eating at the range when prediabetes is showing up already. And we encourage families to refer to that community sources and resources around, like YMCA, really helpful with discounted exercise programs and gym memberships and everything. So
Mhm. Yeah, that definitely makes sense. All right, again, I guess we'll move on to the next one. So, children can simply outgrow diabetes like an allergy.
um, not true. Myth. Um, they can reverse that type 2 diabetes. Type 1 does not. We don't have a full cure yet.
Okay. Is it because type 1 is completely genetic?
That uh, genetic, no, autoimmune. Type 1 is autoimmune. That means your own body cells, your own immune or defense system is attacking your pancreas, islet cells, beta islet cells, it's called, which secretes insulin. So it's like how do I say, like lupus, right? Lupus attacks your own body, attacks is attacked by your own defense system. It's autoimmune.
Okay.
Okay. And then the next one would be myth or fact. Children who look healthy are active cannot have diabetes.
Myth. Um, it has nothing to do with appearance. This is one of the things that I teach my patients all the time. That if I would have to change one thing in their lifetime, in their families or understandings, I would say it has nothing to do with their appearance. There is a lot of shame behind this when we talk about the word BMI more than 95th percentile. So definitely a myth.
Okay.
Okay. So they can eat healthy, they can be active, they can do everything under control and still have diabetes.
It will prevent them from type 2 diabetes very much. Type 1 is not under their control,
Okay.
unfortunately.
Okay. So, I guess this strays away a little bit, but just sort of going off the same topic. So, type 1 can't be reversed. Pre-diabetes and type 2 diabetes, can they both be reversed?
Yes, pre-diabetes can. Type 2 diabetes is controversial. If once you have a diabetes, there are newer research actively been published, and there's a lot of new research showing that you can control your type 2 diabetes and you can be off medications of type 2 diabetes with your lifestyle. Definitely. um, would you say it is cured? Not yet.
So like they would still have to like manage and like watch their like insulin count before like and throughout their lives, even like if they're like hypothetically cured.
Yes, if they maintain their lifestyle, they should be all fine, right? They would not. I would not consider them as like uncontrolled diabetes. That's what I would say.
Okay.
All right, then. I guess our last one is people with diabetes since childhood can become completely dependent on injected insulin. They can't function without it after they try to um, leave that medication.
Paraphrase it again one more time, please.
Yeah, so people with diabetes since childhood become completely dependent on injected insulin and cannot function without it.
That's right. Fact.
Okay, so okay, this is touching on the type 1 thing where it's not
Right.
able to be cured.
This is about type 1. Yes, I think we have to differentiate between type 1 and type 2. Type 1, they are insulin dependent, and the word type 1 means insulin dependent diabetes mellitus, and type 2 is non insulin dependent.
Okay, then. Yeah,
There,
that's I think a good amount.
yeah, there are some researches I would say that is really working on how to cure type 1 diabetes. There are genetic modification and helping type 1 diabetes survive without insulin, and there's something like stem cell transplants and those kind of advanced technology that is helping these patients to live better, uh, do better. But it's not a mainline or like it's not a mainstream primary care um, workflow in my practice, right? I would send them to endocrinologists, I would send them to geneticists, and then they will work with this technology partners and go from there.
So it's not necessarily as accessible to other treatment
Mm.
options.
So yeah, it's very very expensive I think for now, but I think I'm very very hopeful and optimistic that down the lane, I would say 5 to 10 years from now, this technology is going to be creating wonders.
Yeah, hopefully that happens.
Yeah. And
Yeah.
also I was wondering like with these like these new technologies, do you recommend like parents with like children who have like type 1 diabetes, do you recommend them to like try it out now or like to wait to see like more progress in the innovation?
So anytime we ask them to go through the treatment, we definitely ask them to see the specialist and follow the recommendations. And in US, we practice evidence-based medicine. So there has to be enough evidence in terms of clinical trials, meta-analysis, or um, thorough work done to prove that it is effective without causing any complications. And that's where all this governing body comes by FDA who clears this technology or clears this medications to be treated. So yes, I mean, I would still refer them. I would, if they ask me tomorrow, like I will give you an example. There was a patient with short stature coming at 16 or 15 years of age with me very recently, and trying to ask for increasing the height. The guy's height was 4 feet and 11 inches, and he's already 16 and he's fully mature. I examined him. I asked all the questions. I did a bone age study, and he couldn't. I think he's joint his joint centers or the growth centers are fused already in the bones. So, but the father was asking me for about peptides. Peptides are a hot topic right now, and he was asking me. I want to still go through it, and I did refer him to endocrinologist, but evidence is not out there that peptides are effective or do any growth increase in this patient. So it depends on evidence.
All right. So it's still sort of in the stages being developed.
That's right. That's right. And I'm hopeful.
Yeah.
Yeah.
All right. I think that's all the questions that we have. Is there anything that you would like to add? Anything that you want to tell our audience?
Um, I think the myth about diabetes I want to say is that I really wish it would go away. Is that you can tell who has diabetes by just looking at them. That's completely a myth, right? And diabetes only happens because someone ate too much sugar. This is so wrong, right? Every time you eat too much sugar, you get diabetes. That's not right. You prevent diabetes by consuming less processed food, less sugar, maintaining good lifestyle and sleeping better, you know. So that those are the things that I want to give whoever is watching your podcast, the patients, the families, the healthcare professionals, which they already know, that these are all myth.
Got it. All right. Thank you so much for joining us today. And I think that's it. And yeah. So we'll see you guys in the next episode. Thank you.
Thank you.
My pleasure, guys. Thank you so much for having me.